To politics, and let's bring in Senator Thom Tillis, Republican from North Carolina. Welcome to the show, Mr. Senator. As I'm sure you know, Steve Bannon is said to be looking at a 44% tax rate on incomes above $5 million. That would be tax increases on the super rich. What do you say to that, Senator?
Well, first off, if we think that we can pass a tax policy by simply taxing the rich, we're going to run out of rich people. So I'm willing to listen or consider any sort of tax policy that I'm convinced promotes growth. So right now, anything's on the table, but at the end of the day, we have to have something that gets our job sector and job creation going and our economic growth going over the course of time. It's the only way we get ourselves out of the debt that we're in and that we get people back to work on a consistent basis.
Now, the president did mention raising taxes on wealthy people. Now we've got the Steve Bannon report. Is this being just talked about in Republican circles, in the tax debates that you're having?
Yeah, I think it is, Stuart. I think that it, along with any number of things, we had the border adjustment tax discussion. We're having a number of discussions really trying to figure out a way to broaden the base, lower the rate, and stimulate economic activity. And I, for one, haven't done tax reform. I'm not prepared to take any consideration off the table, knowing that many of them will fall to the wayside when we're going to get consensus in the Senate.
Okay. I'm going to show the stock price of Nutrisystem and Weight Watchers. I'm doing that because we hear that the skinny health care reform bill is going to be up for debate fairly soon. Forgive the joke here, Mr. Senator, but this skinny health bill, we hear from the Wall Street Journal that it's getting some support. What say you?
Well, what I say, Stuart, is I don't care if it's skinny, mini, or mo. If it gives us progress on health care, we've got a lot of work to do. I mean, a lot of people need to just dispatch this idea that we have one vote and then we move on to other things. We do need to move on to tax reform, but we've got a series of additional measures that will have to pass out of the Congress and to the President's desk to round out what we're doing with this first bill. So I'm not going to get caught up in the details of the first bill, except I know if we pass it, we can negotiate the other measures on our terms versus a failed foundation of Obamacare.
So we're going to get something done. Is that what you're saying? The Senate will get something passed and handed over to the House? Definitely?
Well, I'm hopeful that we do. I voted for the full repeal this week. I also voted for the Cruz-Portman amendment. This is important for us to show some leadership and willingness to accept something less than what I want in the interest of moving the ball down the road and getting the House on board and getting the first measure to the President's desk. We all need to look at it that way. We've got a solution to the problem. We need to lead here and dispense with perfect in the interest of a step towards good.
It sounds like you're listening to voters who are saying, we elected you to get this done, get it done or else. I mean, you hear those voices, don't you?
I think that's right. And I think also, people talk about political courage. Political courage is not me standing up against a progressive liberal. Political courage is me going to a conservative red meat crowd and saying, guys, we've got to produce a result. This is as good as it gets, and I'm committed to continuing to get to a point to where we get more sound, fiscally sound, conservative solutions for health care in this country.
Senator Thom Tillis, thank you very much for joining us, sir. We do appreciate it. Thank you.
Thank you.
Yes, sir.